You've been patiently waiting for years, perhaps even decades. And with each new incremental advance in hearing aid technology or design, you thought, someday there'll be a genuine breakthrough, one incredibly less restrictive, remarkably more long-term, that feels more natural. That someday is today, finally. The Esteem Hearing Implant, with a design so unique, it's more than invisible, and performance so reliable, it's a 24/7 solution.
Esteem is approved for a specific type of hearing loss and can only be prescribed and surgically implanted by a trained physician. Risks include those typical for surgery. Side effects related to taste and facial movement are possible. It's possible that additional surgery may be required to resolve complications. Ask your doctor and audiologist if Esteem is right for you. Individual results may vary.
The invisible Esteem Hearing Implant. Hear how much better life can be. Talk to an Esteem counselor. Call 1-877-900-EARS.
And welcome back. Well, we have a returning guest today. Nice to see him again, Dr. Jack Shohet, and nice to have you on today.
Thank you very much.
You always bring some great information, and you are obviously, since the name is Shohet Ear Associates, you are would it be called an audiology doctor?
No, I'm an otologist or
Okay.
a neurotologist, an
Okay.
otologic surgeon.
All right, very good. Well, as we all age, we get ear loss. I don't care, even if you're in perfect health, it's just, just like we all end up have to wear reading glasses at one point in time. And it's almost inevitable that it will happen. One of the things that, at what point in time, obviously we want our ears checked, just as something you want other things, your eyes checked and things like that. But at what point in time should someone really start to notice, okay, I'm beginning to have a little bit of a problem? And sometimes they don't notice that. It's the people around them that do, right?
That's very true. It's very often not the person that's having the hearing loss that notices the issue, so much as their friends, families, loved ones that notice that they're having to repeat themselves more often. People start to get more frustrated trying to communicate with the person that has hearing loss. And, the person with hearing loss not really realizing it's their hearing, tends to get more isolated. They become more isolated for that reason.
Right. And, I think we've all experienced that in some form. Maybe it was when I was young when my grandparents were alive or something like that. And it does get frustrating. I think what happens is that the person that is experiencing the hearing loss probably gets frustrated too, because they're saying, why, what are you saying to me? I don't quite understand that. Or they hear certain things, but they don't hear certain ranges or frequencies, right?
That's correct, yes. It's interesting, over 10% of the population has a significant amount of hearing loss. Well over a third of people over 65 years of age, and over half of those over 75 years of age have a significant hearing loss where they need some type of assistance to help them hear. But it's interesting how few people actually recognize it and actually seek help. And it's extremely important, the earlier you do something about your hearing loss, the better you're likely to do long term.
What is actually happening? Why do people get hearing loss? Now, I'm not talking about, again, someone who has some sort of an illness or an ear injury, but much like your eyes, certain parts of your eyes, it's just the muscles begin to wear out, so to speak, so you don't have that focal range. So that's kind of what's happening with your ear in a way, with the eardrum or whatever it might be?
Actually, it's the inner ear that degenerates over time. That's the most common part of the hearing pathway that degenerates with age. So that would be the most common cause for hearing loss. Noise plays a huge part in people's hearing loss. And in fact, that's the reason why we're starting to see hearing loss occur at younger ages now as well. And that's been well researched and documented even as of late. That a significant number of teenagers are starting to show the effects of hearing loss.
Well, obviously with them, now with the, they've always got something in their ears. With you and I, it was probably, remember we used to go to concerts and things like that. You'd walk out of the concert and you almost wanted your ears to be that shattering noise, and they're, oh, that was a great show.
That's right, that ringing afterwards.
Yeah.
Yeah, we didn't realize that was damage to our ears back then.
Yeah, we didn't. And now, of course, with even adults, they got their earbuds on or something like that and don't have them at that proper level, that damage can occur. Now, yes, there are hearing aids, but you wanted to talk about perhaps when hearing aids are not quite enough.
Yeah, so hearing aids are certainly the gold standard for most people. That the majority of people who have a hearing loss are very well served by hearing aids. But there's a certain number of people that are extremely active. They like to swim, they're in the water a lot, they're exercising, they sweat a lot. They want to be able to hear at night. When typically hearing aids have to come out when you go to sleep, there are ways to be able to continue to be able to hear, even at night for safety issues and so on. There are people who don't have the dexterity to put their hearing aids in and out and have to rely on others.
Right.
There are people that can't open the battery. Something as easy as replacing the battery, it's actually not that easy.
No.
These batteries are very tiny, and it's hard to open that little door. So there are other options for people who have some of these issues and are looking for the next thing. And those are the implantable devices. These are devices that are implanted. Some of them are semi-implanted, where there's a part still on the outside, but there's new technology that's totally implanted. There's nothing outside. Your doctor wouldn't even be able to tell that you have anything in your ear. It's all implanted under the skin, and it's connected to your hearing mechanism such that you hear using your own ear as its microphone, and then it is able to directly drive your inner ear such that the fidelity, the sound quality, is theoretically significantly better than what you can get with a hearing instrument. So these are now options that would allow someone to wear their device 24/7. The battery with the totally implantable device lasts between 4 and 9 years. So for 4 to 9 years, you can leave your hearing aid on, never have to take it off when you go in the shower, don't have to worry about losing it, don't have to worry about your dog eating it.
Right.
That happens a lot, believe it or not. So it is now available, and I don't think a lot of people realize that. Even now when I talk about the device, which we've been implanting for close to a decade as part of a clinical trial, people are still surprised to hear that is a possibility in today's day.
Now, the one we heard about over the last, I don't know how long these have been out, but the cochlear implants, and those are the ones that you'll see a little, it looks like something stuck to someone's head, on the side of their head. And now, of course, there are the other ones, such as Envoy Esteem and things like that. Now, are these all the same, in fact, of what they do, or is there a point where someone needs the cochlear one versus the other one?
It's a great question. So what I have been talking about, these implantable devices that are somewhat surrogates for hearing aids. These are when people want to go beyond their hearing aids. Those are middle ear implants. They're implanted into the middle ear, and they're for people with moderate to severe sensorineural hearing loss, essentially the same people that wear hearing aids. There comes a time for some people where a hearing aid or an implantable middle ear device is no longer an option for them. Their hearing kind of slips to the severe to profound ranges, and that's where cochlear implants step in. And in fact, cochlear implants are getting better and better such that their indications are becoming more in the early severe ranges, even late moderate ranges, where people are now candidates for cochlear implants that they were not when they were initially introduced, because the technology's gotten so good.
Okay, so are those just stronger? Is that why you would go to that? Because otherwise I could see anyone going, give me the total implants. Why would I want something?
They work differently.
Okay.
So the way the middle ear implants work is they pick up sound from the outside and they directly stimulate the inner ear.
Okay.
The way a cochlear implant works is it goes into the inner ear and it directly stimulates the hearing nerve.
Oh, I see.
So it
Okay.
bypasses the inner ear, which is usually severely to profoundly impaired in people who are candidates for it, and it goes directly to the hearing nerve.
Okay.
So it's really in the part of the hearing pathway that they stimulate as to how they work and what their indications are.
Okay, so what you see on the outside, that's picking up the sound. That's like a receiver, basically.
That's correct. That's the
Okay.
microphone.
Okay.
And that's actually where the brains of the device are. That's where the sound is picked up, and it's then encoded in electrical qualities. So it's given electrical qualities that is then sent through the skin, and then an antenna receives it underneath the skin, and then
Okay.
sends that sound, those electrical impulses, to the inner ear, where the hearing nerve picks up those impulses, and then the brain translates that into sounds and
Okay.
words and meanings.
Now, do those need to come off when you're showering or swimming?
They absolutely do. Anything where you see an external part,
Okay.
that has to come off.
And is it by a magnet or something? How does it stick there?
It is a magnet, yes.
Okay.
There's two parts to that. There's one that hangs over the ear, looks like a hearing aid, and that's where the processor, that's where the brains of the device are. And then you'll see a little wire that goes to the magnet, and that's where the magnet clips onto the skin, and it sends the sound across the skin to the internal portion.
Okay. Now, have those gotten smaller over the years?
They have gotten smaller, and in fact, they've become water resistant. Some of them can be worn in the water.
Okay.
Actually, couple new manufacturers are coming out with those. But by and large, they're still pretty decent sized devices if you've seen them. But they are gradually improving. They are getting smaller and smaller.
When you get either the cochlear implant or any of these others, one side or both sides do you need them?
That's a good question. It's optimal to hear out of both ears. It's been tested and proven time and time again, certainly starting with hearing aids. It's always important to wear hearing aids in both ears if both ears can be aided. And that goes as well for implants. It's important to hear out of both ears. Hearing out of both ears allows you a few different things. First of all, you have to be able to hear out of both ears to localize where sound is coming from. So our brain uses information that it gathers from both ears to help us spatially detect where sound is coming from. So you have to hear out of both ears to do that. Second reason is you have to hear out of both ears to be able to hear optimally in background noise environments. So your brain uses those cues, the way the sound is hitting the ears, to help detect what is background noise and what is the actual signal I want to hear. Furthermore, people that have a hearing instrument in only one ear, they find themselves turning their head all the time to try to hear with the good ear. And so that becomes annoying for them and other people. So a number of reasons why it's important to hear out of both ears and why it's optimal to wear a device in both ears when it's an option for you.
All right, very good. Well, someone wants to get a hold of you, we have your number and also your website on up. Your number is 949-631-4327, and it's eardoctor.org. You're up, you said, by Hoag Hospital is where
Correct.
your office
Yes.
is.
Yes, we have an office in Newport Beach and in Seal Beach.
Okay.
Yes, close
Very
by.
good. Well, lots of great information. I really appreciate it. And if any of you think you might have a problem, call Dr. Shohet. And first up, obviously, is get your ears tested and all the things you normally would do, and then go from there. With all the latest technologies out there, it sounds like most people can be helped in one way or another.
They can.
Yeah, very
Absolutely.
good. Thank you very much, sir.
Yeah.
We'll be back in just a moment.
You've been patiently waiting for years, perhaps even decades. And with each new incremental advance in hearing aid technology or design, you thought, someday there'll be a genuine breakthrough. one incredibly less restrictive, remarkably more long-term, that feels more natural. That someday is today. Finally, the Esteem Hearing Implant. With a design so unique, it's more than invisible, and performance so reliable, it's a 24/7 solution.
Esteem is approved for a specific type of hearing loss and can only be prescribed and surgically implanted by a trained physician. Risks include those typical for surgery. Side effects related to taste and facial movement are possible. It's possible that additional surgery may be required to resolve complications. Ask your doctor and audiologist if Esteem is right for you. Individual results may vary.
The invisible Esteem Hearing Implant. Hear how much better life can be. Talk to an Esteem counselor. Call 1-877-900-EARS.